Yes, so much to talk about. Of course, I'm just getting off my first ever COVID infection. Went almost 3 years without getting it. Thought I was going to be one of those people who was immune. Turns out not so much. But it's led me to a lot of questions that a lot of you have out there, including test availability. We'll get to that in a second. But, Doctor, first of all, thank you for being here. We've been talking about this triple threat of viruses. You know, we got COVID, flu, RSV on top of all the other usual ones. This is around the time we see things ramping up. And while those numbers are high, it looks like at least hospital admissions for influenza-related illness and COVID illness have actually dipped down a little bit the past 2 or 3 weeks. That's a little unusual, isn't it?
It is, Tim. But remember, this season started pretty early, both for RSV and flu.
Yeah.
And it's still early days yet to say, okay, we're out of the woods. I don't think we're out of the woods because influenza typically in the U.S. tends to peak in January to February time frame. And we still have a lot of holiday gatherings to get through, a lot of travel to get through. There's going to be a record year for travel. So that always concerns me a little bit, that folks need to keep public health measures and precautions in mind as we navigate the next several weeks.
Yeah, so what are some of those best practices? You know, my 5-year-old has a cold right now. Should I be giving him, say, a COVID test the day before we get out for family gatherings? What should I do?
That's a great idea. So, you know, getting those tests, the rapid at-home test, is not a bad idea a few hours before a gathering. In fact, the government is reinstating the program they had earlier this year that was discontinued because of lack of funding in September. And so folks can get up to four free home tests every month. So it's covidtest.org that they need to look up and order those tests, or through your insurance carrier.
Yeah.
But getting tested is one. Second thing is, if you're traveling or if you're in a crowded indoor high-risk situation, then wearing a mask is not a bad idea. Ultimately, we're trying to stay healthy for the holidays and for our loved ones. So consider that. And then one of the most important tools we have in our arsenal is getting vaccinated.
Yeah.
Both against the flu and taking the bivalent COVID-19 booster.
Very curious to see to what degree just masking in the winter months will become a little bit more of a norm, like it is in many other places around the world.
That's right. I mean, understandably, there's a little bit of fatigue, but again, it goes back to how can we keep ourselves and our loved ones safe. And if it means wearing a mask for a few weeks to a couple of months during the cold winter season, when we know these viruses are at their peak, it's not a bad idea.
And, you know, not to make this about myself, but yeah, I went back to wearing a mask because I had COVID for the first time in a while, and it was really uncomfortable for the first 2 days. But then after that, I got used to it again and realized, oh yeah, I got used to this back in 2020. And I'll get used to it again.
Right, when we were all wearing masks. And even now when I'm traveling or when I even go to the gym, I still wear a mask.
You do? Do you find that it winds up hurting your ability to do cardiovascular exercise?
Not at all. It just gives me comfort that, you know, I'm protecting myself and others around me, especially when I know community transmission of the virus, COVID-19 in particular, is so high, but also influenza.
Yes. Good to know those COVID tests. You can start getting 4 again per week. Granted, they go fast when you're testing a lot, but yeah, once a Stop and Shop, they're going for $10 a pop. That can add up very, very quickly. So get them, use them at the right time, right before those holiday gatherings. You should be all right, and we'll keep those numbers, keep an eye on those numbers going forward. Doctor, thank you again for joining us again. This is something we're going to be talking about a lot, guys. But Erica, for now, let's get back to you.